Good morning. Today we will be doing a wet to dry dressing. There are many types of dressings that you will have to be doing in the hospital setting or any type of clinical setting that you'll be attending. But the main thing is to make sure that you follow your doctor's order. They will write specific orders how they want this dressing done. Now, here are the supplies that we need for a wet to dry dressing. You will need some type of bio bag to put your old dirty dressing in. Then you would need two 4x4s. You would need an ABD pad. You would need a suture removal kit to pack the wound with. Then you would need your type of solution, and today we will be using normal saline. And normal saline comes in different styles. We have a bottle of normal saline and we have a Solujet. Then you have your clean and your sterile gloves. Then you will need your Sharpie, a black Sharpie, to write your date and time on your dressing so the next nurse will know when you actually did the dressing. Then you will need your tape, and you will need some type of measuring device so you can measure your wound. So the first thing that we want to do is put on our plain gloves, our clean gloves, and remove the old dressing. Now, when you're removing the old dressing, make sure you hold the skin as you are removing the tape, because you do not want to make any pulls real quick because you might could tear the skin. And then just roll it up. Just pull off the tape and hold the skin as you remove the tape. Then the main thing is make sure that you remove one layer of dressing at a time, because you do not know what is under here. There could be a Penrose drain, and if you just pull the dressing off, you might pull that drain off, and the physician is going to be very upset. So pull one layer of the dressing off at a time, and just remove the inner packing. As you're removing the inner packing, look at your dressing to see if there is any type of drainage, what it looks like, is there any odor, and this all needs to be documented. Then just take the dressing and remove your gloves the way that you were taught and throw it in your bio bag. Then you need to go wash your hands and then come back, and you need to make sure that you look at your wound, make sure that it's healing properly, what color the wound is. Then you need to take your measuring device, measure your wound lengthwise and depth, and that needs to go in your documentation. Then that just goes in the trash. All right, then what you need to do is open all your supplies. Now, I have set my supplies up the way that I will be using them, so you will not be reaching over and contaminating your sterile field. So the first one, we're going to be opening our 4x4s. And do not touch any of the paper because you can contaminate it. And then you want to work away from it. Okay, now if you use a bottle of saline, you would need to hold the label in your palm, take the lid off, put the lid straight up, then lip it first, and you want to lip it the way that you pour it, because you want to get all those microorganisms off the lip of the container. And then pour just a little bit on your gauze, your first one, because it's going to be a wet to dry dressing. So wet, then take your lid, place it back on. Now, if you was going to be using the Solujets, a lot of hospitals has gone to these. All you got to do is just take the top off, and then just always squirt a little bit, and then just squirt that on your 4x4. Okay. Then always tear your tape before you put your gloves on, because tape and gloves has a tendency to stick together. And always look the way the dressing was attached to the patient before you take it off, and try to put it back on the same way. All right, then you have your sterile gloves. You open those up. Now be careful not to contaminate your sterile field that you have already opened. So find a place that you will not push the paper of your sterile gloves over your other material. And you have been taught how to put on sterile gloves. Okay. Once we have our sterile gloves on, then you need to pick up your forceps. Take your first gauze, unwrap it, and kind of just pull it in your hand, and they call this fluffing. Most of the physicians at the hospital like it fluff to put into the wound. Then take the little corner of your gauze. Now the easiest way that I have found, these forceps have teeth on them on the inside. Keep your forceps together and the teeth will not pull that gauze and undo your packing. So just keep your forceps together. Just go into your wound. Do not touch the wound with your forceps. And just gently pack it the depth of the wound. And do not touch the wound with your forceps. I can't stress that enough. And then just keep packing that. Then go get your other one, your other gauze. Unroll it, fluff it up. Into the wound without touching the wound itself. Just keep pushing it on there. All right, once you get through with these, the forceps, they go into the sharps. All right, then take your other 4x4s, place those over the wound. Then take your gauze. This is your ABD pad. Lay it over the top. Get your tape. Tape it on the patient. Then get your Sharpie and write the date, your initials, and the time. And the purpose of writing on your dressing is if this was a doctor's order stating to change this dressing every 6 to 8 hours, the nurse that's coming in behind you, if you did not report that you did it at a certain time, they can actually look at your dressing and see what time, and they can go up 6 hours from there. And this concludes wet to dry dressing. Good morning.